Hello, I'm Dr. Elliot Hirshhorn. I'm a board-certified chiropractic neurologist at New Life Functional Neurology and Endocrinology in Greenville, South Carolina. We focus on helping patients with chronic health conditions like PTSD or post-traumatic stress. One of the things that makes our office very different than others is that we seek to identify and to address the actual underlying dysfunctions neurologically that are contributing to the PTSD. So we're not just treating the symptoms, rather we are identifying the source and the cause of the symptoms, and we're doing it through extensive testing. Every patient that comes into our office starts with a comprehensive neurological functional assessment and a blood chemistry analysis that includes 70 different markers to evaluate for things like anemias, blood sugars, electrolyte imbalances, liver, gallbladder, kidney function. We look for thyroid disease, good and bad cholesterol, autoimmunity, nutrient and urine status as well. That's just the beginning, however. Based on clinical history and additional blood work, additional more advanced testing may be ordered, and that can include things like an adrenal stress index, hormone panels, autoimmune testing, food sensitivity testing, stool analysis, and genetic variant screening, as well as others. We have a multitude of innovative diagnostic tools available that allow us to determine very specific and precise mechanisms that may be contributing to the underlying physiological dysfunctions and neurological dysfunctions that are contributing to your PTSD. This in turn enables me to develop a very unique, personalized, and specific therapeutic plan that addresses the main issues that are driving your symptoms so we can get the best possible clinical outcomes. You may be asking yourself, what does any of that have to do with anxiety and depression and PTSD? There are huge connections between your gut, for example, and your brain. If you have gut issues, it can contribute to brain issues and vice versa. Gut problems can lead to neurological dysfunction, contributing to anxiety and depression. And if there's an underlying gut issue, we need to address that. We've got to figure out what those gut issues are by doing more specific testing. Maybe you have chronic inflammation from blood sugar that can be exacerbating issues with the traumatic brain injury. We have to identify that. If you're looking for a quick fix to your brain and you want to have nothing to do with addressing the other metabolic components, then we may not be the best fit for you. We want to figure out what each individual piece is that is contributing to and exacerbating the neurological dysfunctions that are driving your PTSD, and when we do that, we get the best possible results. If you or a loved one is suffering from PTSD and the symptoms like anxiety, depression, and suicidal thoughts, and you want to know how we can help, contact my office today to schedule a consultation to see if you qualify for care. Thank you.